Here in the UK, a new stage of the pandemic began when Boris Johnson said this in July.
We'll move away from legal restrictions and allow people to make their own informed decisions about how to manage the virus.
The plan was clear. In England, there would be no rules requiring masks, social distancing, ventilation in schools or vaccine passes for restaurants. Instead, the emphasis was on the UK's vaccine rollout, on personal responsibility, on accepting that we must learn to live with the virus. 3 months on, this is how it's going. This week, the UK recorded its highest number of daily infections since mid-July, and it's far higher than any of these major European countries. Then these are the UK's COVID deaths over the same period. They're gradually rising, and they're higher than most of those same European countries, though all countries are seeing far lower deaths than before the vaccine. And as case numbers rise, the UK government says there isn't a reason to change tack at the moment. It's sticking with what it calls Plan A. Vaccines are central to that plan, but they're also central to understanding why infections are going up. It starts with the speed of the UK's vaccine rollout. It had one of the fastest starts in the world, and that start is a factor now.
At the start of this year, I think we're sort of patting ourselves on the back for how fast the UK's rollout of vaccines was going. That's actually, ironically, become a bit of a problem for us now, because what it means is that we have this issue of waning immunity.
The point being that immunity wanes over time. Here we see immunity a month after vaccination and then after several months. Now, waning immunity can be addressed with booster jabs, but right now millions of eligible people haven't had one. And then there's children. In September, the UK decided to vaccinate children aged 12 and over, but many other countries started far sooner. And all of this means the government's handling of the vaccine rollout is now under attack.
The booster programme is stalling, with charities describing it as a chaotic failure. Only around 13% of children have actually been vaccinated. His wall of defence is falling down at just the point that vaccination is waning.
Well, as we're hearing, the government would refute that characterisation. But it is true that the rate of vaccinating children, the rate of boosters and waning immunity are all factors when we look at the rising case numbers. And that's not all. Social distancing and masks are relevant too. Indoor socialising in the UK is pretty much at full tilt. Scotland and Wales recently introduced vaccine passports for some large venues, but in the rest of the UK, they're not needed. As for masks, well, in Scotland, they're legally required in some circumstances. In England, the government doesn't require them, though some local authorities do on public transport. In reality, though, it's patchy. Go on the Underground in London, you'll see lots of people without masks. That contrasts with, say, Germany, where masks are legally required in some places and use is high. And the Labour Party thinks there's a lesson here.
Is it too much to ask, really, to ask someone on a crowded bus or tube to wear a mask? But also, why, forcing people to go back to work or ending any social distancing and ending advice about ventilation. All of these mitigations have been maintained on the continent. Their levels are now a fraction of ours.
The data on the impact of mask wearing on the UK right now, though, is far from straightforward. There is, of course, large-scale research showing masks reduce transmission. But as John Byrne-Murdoch of the FT notes, data suggests right now they're not a major driver of case numbers. In a long Twitter thread, he posted, if you're encouraging, or at least not discouraging, lots of big, crowded indoor mixing, you'll get more transmission, masks or no masks. And we know that despite some policy differences across the 4 nations, including some mandatory mask wearing, we're seeing similar COVID patterns for all of the UK. And those patterns are leading some NHS leaders to call for a range of measures to be brought back. They say it's time for the government's Plan B.
We are saying it is at risk and we need to take measures now. Measures like wearing masks in crowded places, avoiding unnecessary indoor meetings, working from home if you can.
The government, though, doesn't agree with changing tack at this point. But listen to this from Sajid Javid.
There are many more things that we can all do to help contain the spread of this virus, like meeting outdoors where it's possible, and if you can only meet indoors, letting in fresh air, like wearing a face covering in crowded and enclosed spaces.
This advice raised eyebrows as Mr Javid and his Conservative colleagues don't wear masks in the House of Commons. But that plays into the government's emphasis on personal responsibility, on individuals taking their own decisions. The question is whether that approach, along with an emphasis on the vaccine, will be enough to keep the virus at a sustainable level for the NHS. Well, here's the rate of hospitalisations in the UK through the pandemic. It's rising, but this is nowhere near the first or the second wave of COVID. But there are risks here.
This is probably the first season where we will have significant amounts of COVID circulating as well as flu. People's behaviours have changed. We're mixing more. Winter weather is coming along. Everybody's going into enclosed spaces.
And if this winter is a bad flu season, it'll make the UK particularly vulnerable to rising COVID hospitalisations. And look at this chart. The UK has fewer hospital beds per person than Spain, Italy, France and Germany. Now, that lack of capacity is not caused by COVID. That's a far broader discussion about how healthcare works in the UK. But COVID can apply pressure to that capacity. And as we consider these differing analyses of what to do with the UK's current situation, here's a word of caution on being too definitive.
At the moment, it's not clear whether what we're seeing at the moment will continue to increase as we move towards Christmas, or as some modelers have suggested, actually will peak sometime this month and then start declining.
What is more certain is that the UK government strategy rests almost entirely on vaccines, and that's not what the World Health Organization is recommending.
The WHO's position is that we can't only rely on vaccination at the moment to suppress the virus.
Since July, though, that is almost exactly what England has done. Life in many ways has gone back to normal, with the benefits that brings and the rise in cases that brings. And now, with the NHS warning that a tough winter is coming, so too are tough decisions for the government. It believes that for now, vaccines alone can work. This winter will reveal if that's right.